Republican Brian Kemp unveiled his first detailed healthcare policy on Wednesday, proposing to boost the rural hospital tax credit program and seek federal waivers to help stabilize insurance premiums. He also opposes expanding Medicaid, a key tenet of Democrat Stacey Abrams' own campaign for governor. In unsparing terms, he said such a move would reduce access to quality care and lead to sky-high premiums. He said the solution is not more government, adding that his plan would deliver a patient-centered system that's right for Georgia, not California. Kemp chose a symbolic setting for his announcement. The Cook Medical Center in ADEL, which was on the charge of shutting down last year before it partnered with a large hospital. At least 8 rural Georgia hospitals have closed and an additional 21 have faced severe budget shortfalls since 2001, and Kemp said his plan would help shore up the flagging system. Abrams has highlighted the plight of rural hospitals, long saying the medical expansion is the key to economic growth in struggling Georgia communities. In a statement Wednesday, her campaign called it the only way to cover roughly 500,000 uninsured residents and preserve the rural healthcare system. Saying the estimated cost, Kemp and other Republicans have long opposed the move, which ranges from $246 million to $468 million a year, would be too pricey in the long run. He added a wrinkle to his policy, though, when he said he would support a broader Affordable Care Act waivers modeled after a Wisconsin program approved earlier this year. That 5-year waiver is designed to create a $200 million reinsurance program to stabilize premiums and protect residents with pre-existing conditions. We believe that going to lower cost, increase market and make health care more accessible, Kemp said, adding, "You can call it a waiver, you can call it an innovation. There's all kinds of different names. I call it more innovations, more private sector solutions." Kemp's plan also calls for an expanded medical school loan forgiveness program to increase the number of obgyn and primary care doctors in rural parts of the state, as well as the creation of State Commission on Mental Health to address teen suicide rates and prescription drug abuse. And he would support association health plans, which let small business band together to create health insurance plans at lower cost but fewer benefits. That strategy is criticized by some healthcare advocates who say it could drive up costs by sapping healthy people out of the broader market. Another part of his platform would increase the rural hospital tax credit program from $60 million to $100 million, an increase that's also embraced by Geoff Duncan, the GOP nominee for Lieutenant Governor. Those measures could be endangered, however, by a proposed federal rule that could limit or eliminate the federal tax break donors get for giving to such state programs. Kemp's plan was released after weeks of needling from Democrats, who have launched a TV attack at blasting him for an issue space that included only 7 words on health care. Kemp said, "You'll be glad to know that I am not taking my marching orders from the Democrats, and we have had more policy proposals out longer than anyone else in this campaign. We have been talking very strategically about the things we want to talk about in this campaign." Ifrail Ajom, US 7 News.